Hi, it's Dr. Sharon. I am trying to wait on you guys to come on, but as usual, my whatever you call this, my Facebook Live will be recorded and available. Let me get myself situated. This is going to be quick. It's Sunday. I'm in Maryland. It's rainy. I'm so glad to be home. Just left church and had a wonderful time. Shout out to my home church, Ebenezer AME Church in Fort Washington, Maryland. The 11:15 service is going on now, so you can stream. Go ahead and jump on. It was our musical celebration. So the choir was great. The dancers were great. All of that. I actually am usually a little late to church, but I even made it within 15 minutes of the start time. So for my Ebenezer folk, y'all know that if Dr. Sharon roll up and it's not, a few minutes before the sermon, I'm doing pretty good. I talked to my mother on the way to church, and I was like, Ma, she was like, you already in the car? I was like, what you mean? Church started at 7:45. She was like, Sharon, you usually in the car at 7:45, and you live 45 minutes away from the church. So anyway, I am so glad that I was in town and was able to make it to my home church today. Happy holidays. I celebrate Christmas and all the holidays, but happy Kwanzaa, happy Hanukkah. Kwanzaa hasn't started yet. Happy Kwanzaa, happy, it's not Passover. Happy Jewish holidays, happy everybody holidays, whatever. But I celebrate Christmas, so Merry Christmas and Happy New Year. So this is going to be sort of quick. I haven't done a Facebook Live. I need one of those little pod things. I need to ask Santa Claus for that. One of these little things that you hold. So I haven't done Facebook Live in a while, but every single day we get questions in the office. We get questions via email, and I try my best to answer them. It's just been hectic. I have been in final edits for Hi Couture Parker. What's up, homegirl? I need another one of those wreaths. The Couture Parker makes wonderful wreaths. She made an AKA wreath for me that I need to put up on my door. Hi Couture. And tell your mommy I said hi. And so it is the holiday season. Today we had children up at the church, and it's so amazing that Couture is on, because I remember being at Bethel Baptist Church, my home church in Kannapolis, North Carolina. My first speeches were in Kannapolis at BBC. I attribute a lot of my own personal, whatever perceived success I have at that little church, giving speeches, giving speeches, doing my Christmas speech, my Easter speech, all of that. I never really did the plays. Many of you know my brother, who's an attorney Rod Allison, but he's also a hilarious comedian that is equally successful as a comedian. He gave his first talks there, all of that. My brother did. All of us were in the church and did speeches, had to memorize stuff. My father would not let us get up with a piece of paper. So if you gave a speech, you had to memorize it, and he would tell you how to animate it. And so today, the children were singing, and the babies were cute. I even thought about for 5 seconds that I probably need to adopt a little girl. Yeah, that was about 5 seconds. The little girls were so cute. I text somebody and said, I need to adopt. Yeah. First of all, I don't change diapers, so it couldn't be a baby. And second, I got enough adopted kids and adopted grandkids now that I just need to call one of my children. Heather, maybe I'll call you, tell you, send the girl child on the Diva Grandmommy, and let me play with her for a little bit. So, yeah. But anyway, I did have a wonderful church service, and it was our Christmas holiday celebration. Do go online right now, and you can stream Ebenezer. And as I wait for a few more people, Couture says, your father made all of us speak, even when we didn't want to. You are so right, and I'm grateful. He would. Now, imagine, Couture, if it was just the regular Sunday school versus the Allison kids. I tell anybody now, I'm not afraid of from the White House to the outhouse. My biggest critic and my biggest cheerleader was my father. So if he said, oh, you did good, I was good. So that's why I'm not afraid of public speaking, because Daddy made us do it, and even in writing. And so thank you for that comment, Couture. It is the holidays. This will be a quick Facebook Live, but it's the holiday season. I do want to just say happy holidays again, Hanukkah, all of that to everyone. And, I'm talking about my dad a little bit, and many of you know, especially if you know me personally and my family, but if you know me personally or if you follow me, usually I haven't given a speech that I haven't referenced my father in. And many of you know that my father went on to glory about 3 years ago. And so the holidays are difficult for many of us who still deal with grief and the loss of a loved one. And then you're able to embrace or try to embrace a time where you think of the good things. For me, my father was the big Christmas guy. I mean, he went all out. I had magical Christmases as a child. And then after I was older and did my own things, my Christmas holidays are pretty much quiet and a time of reflection. So I do, getting back to, not about me, but to what the purpose of this Facebook Live. I haven't done Facebook Live in a minute. I've gotten your little emails. Even somebody in church stopped me today and said, you haven't done Facebook Live in a minute. So I said, go home. By the time I get home, I will do Facebook Live. So I want to focus on a couple of things. Number one, I do want to give a shout out to those who have living parents, living family that's near you. Embrace them, love. Everybody got people to get on your nerves. Everybody got family and friends that get on your nerve. Everybody. Ain't no perfect family or whatever, but I'm telling you that you should embrace them and love on them. And that's not about a gift. That's not about what you wrap up. It's about time, because I can tell you now, as an old woman, 35 and older, that I would give all my worldly possessions literally for just 10 minutes at my father's feet. To just put my head on his chest or in his lap, or just hear him call me his nickname for me. And that's what's important, whether that's your father, your mother, your grandparents, your husband, your wife, whatever. It really is important for you to carve out some time, not just during the holidays, but at all times, to carve out some time and tell people that you love them, that you appreciate them, that they are worth your time and energy, even if it's just a phone call, a text. I'm a big card person. If you see a post that I put on, what's up, cousin April? We were just talking about your Uncle Thomas, my daddy. But if you really honestly spend time, send a card. I just put a post on that. It's been shown that actually receiving cards in the mail has a health benefit. I know that we all do texting, we do phone calls, we do the electronic gift cards, and this is not self-serving, because many of you know I have the greeting card line, Cards by Dr. Sharon, but it's not about that, because I'll just buy cards and send them. And I know even this week I received a lot of Christmas cards that really make me smile and make me happy. I received a card from a long ago friend who just was so encouraging and just wrote a few words on a piece of paper and in a card and just shared with me. Those little things are what make us human. It makes life worth living. And relationships and friendships and familial ties, all of those are relationships. It really is what separates us, the living, from those that aren't with us. And so don't wait until somebody dies for you to spend time with other family members. Don't wait until somebody dies to send them flowers, And then, by the way, please follow me on Facebook and Instagram and Twitter, whatever. I really mean it. Sometimes you need to buy flowers for yourself. You don't have flowers? Anybody bought you flowers? I was in the grocery store the other day. I said, look at these little stargazing people. They're my favorite flowers, a stargazer or a starlet. I bought 3 bunches, put them in some water. They're still alive, whatever. It makes you smile and makes you happy. Buy a card for someone. One of my Sunday school teachers, actually, Couture, from Bethel Baptist Church. I just bought her a card. and I'm going to make sure I put that in the mail to her. As well as, well, cards by Dr. Sharon will be going out. The Christmas cards from my own line. And we're introducing our new line coming up in January. But the holidays are a great reminder for us. My nieces and my family and all of that. And again, Thanksgiving is my big family holiday, but certainly to be on the phone with them and to do whatever is necessary for you to navigate the best way you can. Now, from a health tip, make sure that even during the holidays, you continue your workouts. Don't wait till January 1st to start the whole, I'm going to lose weight, I'm a size 28 now, I'm going to be a size 8 by February. No, that ain't going to happen, boo-boo. No. Just take it slow. Don't wait until January to join the gym. Right now, if you want a gym or know that you need to work out, and those things start now. Somebody say now. Somebody just type now. Because tomorrow's not promised. And so it really is important. And after this Facebook Live, I'm going to put my hair in a ponytail, put on some gym clothes, hide Frederica Sneed, and go work out. So let's just not wait until the magic of New Year's Eve, and now I'm going to do all these wonderful things. Don't wait until New Year's Eve to tell people that you love them and that you value them and start the year off right, or wait till Christmas. Go ahead and call somebody today. Go ahead and start today. Ain't nothing magical. While we celebrate Christmas on December 24th, actually, if you look at it biblically, Jesus was probably born a little earlier in the calendar year, if not in the spring. I'm just saying we celebrate Christmas at this time, but I'm just saying. All right, so let's talk about health tips. I have to continue to say I do get daily updates on a couple of servers that I'm on and some committees that I'm on. Flu is really, really, really important, people, especially before you go see all your cousin and them and everybody at the house snotting and coughing over food. Go ahead and get the flu vaccine. Get the flu vaccine and make sure you have plenty of, you may need coldies or airborne for if you're getting on a plane, because if you think about it, if you are flying or on a train or whatever, that's a confined unit, and yes, the air comes through, but all them germs come through, and people nasty. People nasty. People be coughing and then put their hand on the thing and all that. And speaking of the gym, make sure that you wipe down your treadmill. I wear gloves when I lift weights, and I usually wipe down and have disinfectant on my gloves. Wipe down things, because the cold and the flu are transmitted via, how do I say this? Spit, basically. Spittles. And airborne, right? And so if you have a cold and you cough and then you're on the treadmill or you're sweating on all that stuff is nasty, all right? That's how you get a cold. It ain't that it's cold outside and you're going to get a cold. No, that's not it. You get a little chill. But make sure that you do get the that you get the flu vaccine, and for our elderly especially, that you get what's called pneumovax. If grandma's 60 plus, get pneumovax, 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 pneumonia vaccine, pneumovax. I'm sorry, it's Sunday, I'm supposed to be off, whatever. So, pneumovax, and you would get that every several years. Talk to your doctors about that. Certainly, if you have an egg allergy, you don't get the flu vaccine. But flu don't give you the flu. I'll say that again. I just did a radio interview where I talked about that flu don't give you flu. When we talk about all this foolishness, go ahead and get the flu vaccine. And it doesn't mean that you won't get the flu. It just means that, number one, if you do get the flu, your symptoms won't be as bad, prayerfully. But it is protection, okay? So as we go into the holiday season, we know that we're going to have more calories. Build in your workouts, build in your vitamins. I will say again, as I get this question, and I know we have like 50 of them, even over the last 2 weeks. Dr. Sharon, go back over what vitamins you recommend. Well, it's now the winter, so I do change a little bit. So one, a good multivitamin. I can only tell you what I take. Right? So I take Centrum Performance and Centrum Woman. Centrum doesn't pay me any money. But they can. But they don't pay me anywhere. But those are good vitamins. For male friends, I have recommended Centrum Performance. They have a great energy vitamin as well, and they have a great Centrum male vitamin that is wonderful to use those. And then I take, I'm just talking about me, calcium, and because of my age of 35 plus, vitamin, I take calcium. And I take vitamin D because I do have some vitamin D deficiency. And I can guarantee you, if you go to the doctor and you get checked, they're going to say your vitamin D low. I don't know what it is. We really just, when I was in med school decades ago, we didn't really check for vitamin D. Now we start checking so everybody deficient. But anyway, take some vitamin D. And then I, as a woman, still am taking some iron several times a week. So those are the basics. Hair, skin, and nails are important to me. I take a hair, skin, and nail vitamin that is something I take several times a week. Other things that you may want to kind of pulse in, especially now during the winter months where cold and flu are more prevalent. Echinacea, coldies, airborne, those kind of things are not going to hurt you. Vitamin C is not going to hurt you. And it may give you a little bit of a boost. Every black person has vitamin D deficiency. Arletta Whitaker, yes. And Caucasians too. And let me just do a little bit of teaching. You need vitamin D to convert your calcium into a usable format. So that's why we do calcium and vitamin D. So yeah, and vitamin D actually will also help with hair and nail and skin and that stuff. So if you have a little vanity, you can do that. I talked about iron. Iron is very important, especially for women who still have their periods, because think about it, every month you lose blood. And iron is carried in the blood, and iron is how you know that you actually carries oxygen. If you are iron deficient, and really iron deficient, you actually, oh, there's another homegirl, Valania Long Abraham, what's up? You can get short of breath. And we kind of play around with anemia, but anemia can be life-threatening. Okay? Iron carries oxygen. And so when you go to different altitudes, if you are iron deficient, you are not able to breathe well. And men can be iron deficient as well. So kick in a little iron, and then Fiasol is one that I use. And then you can have, well, people say, I don't want to take iron because I get constipated. Well, try a slow iron. Okay, and that will help. Slow Fee is a great iron that will help in that. And then just pop some more fiber, hopefully, in your food. So have an apple. You know when you eat an apple, what happens? You go to the little bathroom, or actually drink some coffee, because coffee actually will help you use the bathroom as well to do the number 2, as my nieces say, number 2. So I think I hit pretty much the vitamins. Y'all got any questions on that? But this is a good time to make sure, again, that your immune system is in fighting shape because of the increased amount of colds and flu and all of that. And we get stressed out during the holidays. Stress actually is the biggest hit to our immune system. It's the biggest hit. And not sleeping is a big hit to our immune system. And so if you have a pre-existing condition or have had other things going on, then you have issues. What's up, Keith Harley? Y'all, please go check out Keith Harley. And many of you have been the Beautiful Woman Inside and Out. Y'all know Keith Harley. Go to his site because he is now doing clothes. You need to send me some stuff to wear for you, boo-boo. He's doing clothes. He has a wonderful hairline. Keith Harley is just doing it all. And we know Beautiful Women Inside and Out. Y'all, you know, y'all probably like Keith a little bit more than y'all like me. I'm jealous, but not really, because that's my guy. So do check out Keith Harley. He has a wonderful Keith Harley collection. There are a couple things I have my eyes on, and hopefully he'll post it in this thread. So when and then let's just be real. Let us support people that support us. Now, y'all know I love a Neiman's, love a Saks, love a Nordstrom, love a Bloomingdale's, love all those places. But we also, you look amazing. Thank you. We also need to support people that support us. So Hallmark is wonderful, but I love the people that support Cards by Dr. Sharon. All right? I love the people that support my books and go ahead and get me to come talk and speak or whatever. So let's make sure that we support local businesses. And Keith is just doing it up. So Keith, please put your website on. I know Valania is on in April. Y'all know Keith. Y'all love Keith. And so check out his clothing line, which is the bomb. And certainly his hair products are amazing. So talked about loss and grief and kind of navigating through that during the holidays. Talked about making sure that we keep ourselves and our immune system up and running during the holidays. The other thing is, and I talked about this during Thanksgiving, and unfortunately there were several incidences that KeithHarleyCollection.com. I'm going to talk to Keith about getting a beautiful woman inside and out discount. I'm going to talk to him about that offline, but we want to certainly support him. And there again, shoes, bags, accessories, everything. So follow Keith Harley. But one thing that did happen during Thanksgiving, and there was a person actually that is one of my readers that had a major stroke during the holidays, and her daughter contacted me, and basically during the holidays she did not take her medication with her and did not tell her family that she didn't take her medication, and had a stroke actually the day after Thanksgiving. If I don't say it enough, and if you go back and look at the other video about how to travel during the holidays, it's a holiday is another day. Your body don't know that it's a holiday. Your blood pressure don't know that it's a holiday. Okay? Your diabetes doesn't know that it's a holiday and everything's supposed to act right. We still have hospital visits. We still have major issues. Go ahead and pack or order. And if you're going to be out of town for 2 to 3 weeks, this is a little tip. Call your insurance company. You actually can get multiple weeks of medications in advance. That is hi, Frankie. You can get those in advance. Okay? But do not take a break from medication. If you're on medication or whatever during the holidays, again, a very tragic situation where one of my readers came back to me and said that her mother had had a major stroke. And she said, I looked at your Facebook Live, but I never even thought about asking her about it. So go ahead. If you know you're going to be leaving out of town next week, go ahead and pack your little vitamins, pack your medications, and then ask who's coming to you. Do you have your medications? The other thing is, if you find yourself in a location and you did not bring your medication, call your doctor's office. Your doctor's office has to have coverage, and say, I need X number of days, but don't just not take them. The other thing is, as we end the year, go ahead and find out how much, if you have insurance, go ahead and find out how close you are. If you haven't had a mammogram, if you need blood work, if you need to try to get in for another test before you have to get back to your deductible, go ahead and do that between now and the beginning of the year. I'm talking about money. What? I'm doing it myself. What? I'm just like, huh? How many glasses I get with my insurance? Did I use all my benefits? Why are you paying for stuff that you're not using? I don't understand it. So make sure that your preventive things are in place. And remember that in January, for many of us, our deductibles come back. So go ahead, get the glasses, get the little teeth cleaning, all that. Tell them it's important. You ain't feeling quite right. You need a little quick. Go ahead and get, before the end of the year, get as many prescriptions done as you can, and kind of move forward. Other things that you guys have asked me about recently, we talked about grief, talked about the holidays, we talked about mental health, and unfortunately, I've gotten a lot of questions about mental health and opioid addiction. I do sit on 2 boards that really deal with this, and I'm actually going to be writing an article soon, and I'll post it on Facebook and post it on media pages on the epidemic of opioid addiction. And guess what? You know, we're just talking about it more. Opioid addiction has been here since, certainly I was at East Carolina University School of Medicine, and unfortunately we have criminalized a lot of mental health issues where we really didn't need to do that. It's not right that we've criminalized them more in 2019 or 2018 versus the 1990s, because crack was an issue, and that's a criminal issue. But hi, Angie Morgan. So all of those things are really important. But if you are just joining, one of the major things that I've said is make sure that you enjoy life and that you enjoy people that you love even now, especially during the holidays, and that you tell them. You got some that need it, like sickle cell patients, and some. You are right. This is the thing, and with the whole, and Arletta, you can chime in on this, with the whole opioid addiction crisis or whatever, there is a need for pain medication. You can talk all you want to. You come out of surgery, you need some medication. I don't mean no harm. I'm a woman of faith, but you get a bad enough, too bad of enough toothache, you better go crawl somewhere and get some Tylenol, ibuprofen, or something with a little bit of kick. But how do you balance between addiction versus not? And then how are you understanding? And does pain medication make you weepy? Sometimes it does. It depends on, for me, I can't take certain pain medications. Number one, it knocks me out. Number two is that I get hallucinations. With one particular pain medications, I literally would be like, who that's standing there? I just a sidebar, Samantha John is one of the most beautiful voices that I've ever heard. I was trying to wave at church today. She's an opera singer, just a singer extraordinaire, and she has the cutest little baby that I'm getting ready to kidnap. This is my little child, little diva. And I didn't get to see her at church today, but Samantha, you did an awesome job at church. You are absolutely a great talent. And no, I didn't get to see my baby messing around with that offering. I didn't get to see my baby. But they are now suggesting that a dose of 1 gram of Tylenol is effective. Yes. For certain things, let's break down Tylenol and ibuprofen. Let's break it down. You need both in your cabinet. Okay, you need Bayer aspirin or aspirin. It can be CVS. Go with what's on sale. You need baby aspirin and regular aspirin in your cabinet. You need Tylenol or acetaminophen. Same thing. CVS. It's the same thing. Okay, whatever's on sale. That's how I roll. Sale. All right. You need that in your cabinet, and you need ibuprofen. Why? Tylenol is for fever and for acute pain. If you have a headache, grab Tylenol. Okay, first of all, talk to your doctor. This is Dr. Sharon giving you general doctor's advice, but you need to talk to your own doctor that know you. But Tylenol is for acute pain. So if you have a toothache, Tylenol or something like that, or you have a little something going on, you grab 2 to 3 to 4 Tylenol. Okay, Tylenol is excreted through the liver. So we also, if you have liver problems, you need to make sure, okay, wait, should I be taking this much Tylenol, whatever? And yes, there are suggestions that 1 gram of Tylenol is effective. But I say layer. So start with 3. I'm going to be very honest. I usually, if I have a horrible headache, which I do get, I usually take 3 or 4 Tylenol at once. And that's 250 milligrams. So you're right there. But then you have to just watch it. Now, ibuprofen. Ibuprofen is for inflammation. So I'm getting ready to go to the gym. It's rainy outside. I am no longer 18. I'm 35. So my little knees may have a little issue because I worked out a little too hard this week. Well, I'm going to take some ibuprofen before. Okay? So ibuprofen, 800 milligrams, if you go to your doctor, is what they prescribe for you. That's the doctor's prescription. They put ibuprofen, 800 milligrams every 4 to 6 hours. Right? Guess what? If you go to the CVS or Walgreens or whatever, and you get ibuprofen 200 milligrams, 200 times what? 4 equals 800. It's the same thing. You just take 1 pill or 2 pills versus 4 pills. That is prescription strength. Now, ibuprofen, you have to look at the kidneys. Okay, because every drug, everything you do may have a potential side effect. If you eat a bad piece of chicken, you have a bad side effect. So people want to be all puritanistic. I don't want any drugs because they'll have a side effect. Whatever. All right. If you put some lotion on your face and it's too heavy, you can have a breakout, and that's a side effect, right? Okay. So Tylenol is for typically fever and acute pain. All right. Now, hi, Nicole. Tylenol is for acute pain. Okay. Ibuprofen is more for inflammation. Okay. And then you have Aleve, which is naproxen, which is a medication, particularly if you have arthritis and you have joint pain. If you take 2 Aleve in the morning or 1 Aleve in the morning, 1 at night, it is to cover you for longer. But think about it. If it's to cover you for longer, if you got a headache and you take Aleve, that's not going to kick in right away. That's why you pull Tylenol, you pull ibuprofen. So those are the things that you need. And then there is aspirin, which we know is, baby aspirin is good for heart health. Talk to your doctor about that. You know, many of us believe with all of the protections that are out here now from the Food and Drug Administration and stuff slips through. Guess what? If aspirin came to market now, many of us believe it would not get through because there are a lot of side effects with aspirin, but it still is one of the most life-saving drugs that there is. So, okay, we talked about what you need in your medicine cabinet. You need all of them. So don't just have Tylenol. And the other thing, if you have young kids, I was talking, Samantha was on earlier with that young, beautiful baby. Do not, parents, try to mask a baby's fever without calling your pediatrician. Okay? So have these things available. But if your child has a temperature of 103, you get your behind in the car and drive to the hospital or an urgent care or call the pediatrician before you give that child Tylenol, even for yourself. If you have high fevers and you say you want to, Google and all that stuff, you will be knocked out dead in your house taking some Tylenol when you may have gotten meningitis, an inflammation of the brain, and you just are being foolish because you're trying to do some sidebar stuff yourself. Now, let's be real in all things. So for children, and particularly with fever, make sure that you call your doctor. Call your pediatrician, call who's on call and say, hey, my kid has a fever, it's 100. What should I do? If they say do an ice bath or they say give them Tylenol, fine. But also we know that there are always repercussions, and do make sure that you have a healthcare provider. And if you don't have a primary care physician, call the local hospital. There is a helpline. They're not asking you for no insurance or anything. And the other sidebar is if you don't have health insurance, it is the law. You can go to any emergency room in the United States of America and you have to be seen. They cannot turn you away, just FYI. Okay, so I've talked about what needs to be in your medicine cabinet. We talked about cold and flu and how to protect yourself. I talked about vitamins that you need right now. I talked about making sure, and this I'm talking about myself because I still have a little issue with my fire alarms in my house. Make sure, we know that now with gas heaters, particularly in the South, which is where I'm from, kerosene heaters and all of that, we know that there's increased risk of fires. Check your fire alarms again. I've been talking about this for a minute. I don't know how to fix them and I ain't been home, but the little fire things don't work, and I done took them down. So, I have a big house, whatever. I got to get somebody in here for that. But also make sure that you don't leave fires unattended. If you have natural firewood, don't leave them unattended. And then we talked about mental health and grieving and going through and all of that. And you don't even have to, it doesn't have to be the loss of a loved one. It could be that you're going through divorce, or you're going through a breakup, or you and your best friend done fell out. And all of that grief comes in many forms. And how do you navigate that? And sometimes you just need to sit in the corner. And yes, Dr. Sharon's going to say it. Sometimes you need to just sit in the corner, suck your thumb, and eat some Haagen-Dazs butter pecan ice cream, and just have that ice cream and feel your grief, feel your pain, and all of that, and then get up and keep it moving. And that's the biggest deal. I do want to make sure, y'all got any questions before I get off, because I said this was going to be short. Other things that you all asked me about, again, you've asked me about opioid addiction and pain management. I'm actually going to do a full article on that. One other thing, You Make the Decision, which is one of my 2 books that will be out in 2019. One is My Breaking Heart, which is a sequel to All I Ever Did Was Love a Man, as well as a re-release of All I Ever Did Was Love a Man, is coming very, 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 very soon. And there may be some production stuff in the works. I don't know. But My Breaking Heart is the sequel. But then the really practical You Make the Decision is coming out. And this, I never do Facebook to promote stuff. I will do it when I've released all of this. But you ask me questions. You can always reach me at Dr. Sharon online. Dr. Sharon at Dr. Sharon Online, and our websites for both Dr. Sharon Online as well as Beautiful Woman Inside and Out and Cards by Dr. Sharon. All of those will be updated and out in January. I have already begun getting a lot of speaking engagements for 2019, so if I'm on your list, y'all email me to get on the books or whatever. I love talking to you and coming out, and there will be a book tour in 2019. And yes, I saw some Beautiful Woman Inside and Out devotees. Yes, Beautiful Woman Inside and Out conferences are coming back in 2019. We are revamping, and we're also considering doing some quick hit lunches with Dr. Sharon in several places. But I wish you all the peace and joy of the holidays. Y'all don't kill nobody out there in the parking lot. In the parking lot with these people crazy out there trying to get holiday gifts. But the best gift you can give anyone is yourself, your time, your energy, and your love. Any other questions? I don't talk enough about men's health, and I see some men are on. What questions y'all got? Number one, get your prostate checked still. Number two, get your PSA still, particularly if you are a minority man, which we know that prostate cancer is more aggressive in you. As I say in public talks all the time, y'all talk about getting a prostate exam. Y'all can't take a finger in the booty, but your wife and mother of your children have that big head, 10-pound baby. Y'all, it take about 5 seconds. Ain't no big deal. All right. The other thing is you also need to make sure heart disease, particularly in men, as well as everyone else, is a big issue. And so we need to make sure that your blood pressure is less than 120/80. And I did say less than 120/80, that we follow a low-fat diet. Oh, there was something out that I did get emails about. Keto is a diet that's out there that is heavy protein, heavy meat, less fruits, less vegetables, and all things be balanced. For me, I'm doing a modified keto, which after I get off here, I'm getting ready to go eat my egg. I eat an egg and egg beater every single morning, whether I put spinach and mushrooms and tomato, and that's all extra, but an egg and an egg beater, because egg is one of the best foods that you can ever eat. It's lower in calories, but it's rich in nutrients, vitamin A, D, E, and K, niacin, B12, all of that. An egg is a wonderful food. We talk about fats and cholesterol, everything in moderation. And so for me, I eat one egg and then have egg beaters in that to make a nice little omelet with cheese, and that gives me some calcium and dairy. Theoretically, you should not need vitamins. I'm talking about vitamins and supplements all the time, but theoretically, you shouldn't need them. You should actually be eating 5 fresh fruits and vegetables every day. You should eat your dairy, drink your dairy, and all of that. But many of us don't do that enough. But if you have a high protein breakfast, break fast, so you should be eating breakfast, break your fast, then that actually keeps you from being so hungry during the day. And carbohydrates, like having a piece of bread, having some crackers, those things burn off fast and make you hungrier. So there is a new study out that talks about high protein diets and high meats actually may have some detrimental effects. I'm probably going to post that article, but we're talking about massive doses. We're talking about just, you don't need 3 ribeyes in a day. Now that's stupid. Now you know that you don't need to eat 3 ribeyes in one day, right? So everything in balance. Just like we used to talk about 8 ounces of red wine a day is great for the heart. Well, if you drinking 16 ounces, 32 ounces of wine, time I'm doing this for my heart, and your liver is shot because you're really an alcoholic trying to look for an excuse, that don't make no sense either. So let's just be balanced. All right? You know, I try to keep it real. Let's be balanced in all things. Other question that I got the keto question, which I'm going to answer. I actually got stopped today in church about keto. She was complimenting me, and I said, well, I'm doing modified. Bottom line, and y'all can't order the book, Is That Fried Chicken Wing Worth It? My book on weight loss. Let me tell you. Bottom line is this. Eat less, work out more. That's all, whether that's keto, whether that's whatever, intermittent fasting, which I've talked about and talk about it, all of that, at the bottom of the line is You have to eat less, work out more, and then there are other factors like if you're taking certain medications, if you're taking steroids, whoo, that's a hard road right there, because steroids actually will put weight on you, so you're going to have to cut back more, work out more, and then sometimes you just have to embrace, this is the fat season of my life. And then steroids, antidepressants, often those will put weight on you. Other medications will, and so you just really have to balance. Okay, that's it, and that's all. You all have a wonderful Sunday. I'm going to put on some workout clothes, prayerfully get to the gym after I eat my egg because I'm hungry, and drink some coffee. But thank you for your continued support. Hey, repost this and look at the comments, and then I will repost it, and it'll be available. I talked about a lot of stuff, and as always, email me at drsharon@drsharononline.com. I do personally answer all of my emails. It may take me a minute because it's gotten really ridiculous, but it may take me a minute, but I do, and then I do try to do Facebook Live to address some of them. Have a wonderful Sunday. Enjoy Sunday. It's rainy. And then finally, y'all know what time it is. How about them Cowboys? I'm a cowgirl at heart. We playing today. Super Bowl champs 2019. I can't wait. We ruling the East right now. Y'all have a great day. Holla!